Hello ladies and gentlemen, my name is Dr. Richard Kaul, and today, predictably, I'm going to be talking about the human spine. You know, I've been living with this thing, I have one myself, but I've been living with it in the backs of other people for many, many years, treating them, helping them get better. But this thing, this is a plastic model, of course, it's not, it doesn't belong to somebody. It is the biggest source of pain in human beings. And what I'm going to do, what I'd like to do, is to give the viewers a little explanation of what the different structures in the spine are and where the pain comes from. For example, when you have back pain, when you have neck pain, leg or arm pain, really what's going on in the spine and what it is that your doctors suggest that will help you get better. So, just very quickly, this is a side view of the spine. This little bowl at the top represents the base of the cranium, the skull. This part of the spine is known as the cervical spine, and there are a total of 7 vertebrae. That's the bony structures you see, and they have fairly complex arrangements with these things called spinous processes. Below the cervical spine is the thoracic spine, and there are 12 thoracic vertebrae. And then below the thoracic spine is the lumbar spine, which is one of the areas of the back where a lot of patients complain of lower back pain. And then when you go below the lumbar vertebrae, of which there are 5, you have the sacral vertebrae, and then you have the pelvic bones attaching to the sacrum here. Now, you can see that, you know, to someone seeing this for the first time, you're like, what the hell is that? Well, you know, as I said, the bone, I'm going to use my pen to point this out. These white structures are the bones. The areas in between are the intervertebral discs. These are the shock absorbers that help the spine absorb the pressures that come about from walking. Over time, these discs degenerate, and they are actually the #1 cause of neck, mid and lower back pain. Now, you can see that the discs are closely aligned to these little yellow structures coming out here. These are called the exiting nerves. And these nerves come from the spinal cord. And what they do is they provide both motor for the muscles and sensory for sensation function to the arms and the legs. And for example, a lot of patients that go into clinics with complaints of back and leg pain, they may have a disc, a herniated disc like this. And on this plastic model, what they've done to represent the herniation is they've colored it pink. I don't know if you can see that. There's this little pink zone here. That's a herniation. What a herniation is it's a protrusion of a disc. It's a disc that has, over time, gotten weak. There's been wear and tear for whatever reason, age, occupation, trauma. And that part of the disc protrudes or herniates into the space where the nerve lives. That space is called the neural foramen. Now, in this little location here that you can see, you see this nerve root coming out. It's getting pinched by the herniation. So when a nerve root gets pinched, it starts to do all types of funny things. Usually, the first indication that you've got some nerve impingement is like a vague pain that just won't go away. And that pain will radiate into the buttock, and sometimes down the thigh, and sometimes all the way down the leg, depending upon which of these nerves is being pinched. Now, over time, if it's not treated, that sensation of pain can progress to numbness, and it can progress eventually, if it's completely unattended to, muscular weakness. And so, when patients come in and they say, am I going to lose the use of my leg, doctor? You know, the answer theoretically is, if we do nothing, yes. However, what happens in most instances today in modern day America is that patients that have these symptoms, they undergo courses of what are referred to as conservative treatment. So they'll undergo physical therapy, some chiropractic care. Their doctor may prescribe them some anti-inflammatory medications, some muscle relaxants. And for the most part, most of these patients get better. However, there's a small group of patients that continue to persist with symptoms, and those patients are then referred to what are called pain management clinics. And some of you may have been to these pain management clinics, and what they are are clinics that are overseen by physicians that have specialized in the management of chronic and acute pain conditions. And in many instances, the first treatment that these doctors will institute will be a lumbar epidural injection. And what that does is it takes a needle, and the doctor, under X-ray or fluoroscopic guidance and interpretation, will place the needle into that particular space. Having confirmed that he's in the correct spot, he will then inject some corticosteroid and some local saline to assist in the reduction of inflammation of the disc. This theoretically should lead to a reduction in pain that the patient experiences at that level. And what normally happens is that these patients will, after a series of 2 or 3 injections, have a significant amount of their pain disappear, and with some therapy, usually in water, they get back to normal. If they're overweight, they're instructed to lose weight, instructed to maintain an exercise program, and importantly, maintain a healthy diet. Because that's one of the things in the United States that people have, unfortunately, over the years taken for granted, the importance of good, healthy nutrition. So, one piece of advice your doctor might give you is avoid fast food, which is a great piece of advice across the board. Now, as I mentioned earlier, there are a very small percentage of patients that will fail all of these therapies: the physical therapy, the chiropractic care, the epidural injections, and they will continue to experience very severe back and leg pain, and it can be very debilitating. So much so that they're unable to work, they're unable to walk around the house, and they really become incapacitated. And it's that small percentage, usually about 5 to 10%, that require further investigation and surgical intervention. Now, I've spoken about this before, and it's almost like it's old hat now, but the technologies to surgically treat patients with herniated discs have improved vastly from 10 years ago. Today, people are treated using minimally invasive surgical approaches, which means that instead of making wide, large incisions, opening up the back, destroying the muscle, having the patient lose a lot of blood loss and have to stay in hospital for 3 or 4 days, they now instead go into one-day surgical centers. They have small probes and catheters placed, again, under fluoroscopic guidance and interpretation, which is known as FGI. This is the key element of the minimally invasive approach. The probes and the instruments are placed into the disc, and under X-ray and video control, just like the young lads that play video games, the disc or the affected portion of the disc is removed. Now, this is a huge step forward in spine care, because what it means is that a procedure which is an incredibly painful, which is a consequence of an incredibly painful condition, has been treated, and the patient can be discharged the same day. And as I just mentioned, one of the main advantages of that compared to patients who have to spend 3 or 4 days in a hospital setting is that the incidence of infection is markedly lower. This leads to a quicker recovery, a lower cost, and a much faster return to work. Now, I just described a lumbar discectomy. It's called a lumbar decompression, a laminectomy, discectomy. There's a number of different terms that doctors, magazines, articles might use, but it's the same thing. It's the removing of the affected portion of the spine. Now, those patients, the majority of them do very well. They go home, they have no more pain, they get back to work, and the back pain is a distant memory. Unfortunately, there are some patients, and a small percentage of those, that continue to experience pain, not just at that level, but at levels above and below. And they have what we refer to as multi-level disc degeneration. Now, these patients are slightly more complicated, and because their conditions are more complicated, the treatments are similarly a little bit more complicated. But again, Because of the minimally invasive technology and the techniques that we use, we can treat them using those approaches and fix their problems. And the surgery that most of these patients require to address their problem is what's called a minimally invasive lumbar interbody fusion. And I know that the word fusion over the years has gotten a bad rap, and understandably so, because in the past, when patients had fusions, the operations or the way that the doctors approached the spine, it was somewhat medieval, and there was a huge incision, a vast amount of blood loss, and a protracted recovery, sometimes up to 9 months. Well, the good news is today that has been cut right down to the point where these procedures, these complex spinal reconstructions with interbody devices, little stabilizers, screws and rods, can all be done on a same-day basis. And the reason is because the technology that has been developed by companies that specialize in the spine care sector has vastly improved. But I come back again to the central, most important part of all of this, and it's fluoroscopic guidance and interpretation, which is the use of a portable C-arm that allows the doctor to visualize the spine. So the patient will be lying on the bed, and the fluoroscope will move in, and the physician, or the X-ray technician, because that's usually who operates the machine, will move the C-arm accordingly so that the physician has the appropriate view. And when he places his instruments, his probes or his cannulas, they go into exactly the place that they're meant to be in. So, I would say that the spine sector, in my opinion, has been probably the sector in the last 10 years that has seen the most significant advances. And my prediction on this is that it will continue to do so for the next 5 to 10 years. And now coming into the treatment armamentarium is the utilization of stem cell therapy. So if the instruments that we're using at the moment are significantly smaller than the ones we used 5, 10, 15 years ago. Now 5 years from now, they're going to be even less invasive, and we're going to be using stem cell therapy to augment and help these discs, which have degenerated, rehabilitate and regrow. These principles of auto-regeneration, stem cell use, can be used throughout the spinal column. And again, one of the most, I think, exciting areas of neurological injury, spinal injury, and stem cell therapy is the fact that patients who very tragically have had accidents that have involved as I described, the cervical spine, which is a much more complicated and fragile region of the column. Young lads who've been on motocross or car accidents or speeding boats, and they have fractures in the cervical spine, and the most common location is at the C5, C6 level. Now, in some of those cases, the cord is what we call transected completely, which means that it's completely severed. That's the worst case scenario. In other instances, there's just what's called a contusion or a bruise, from which the patient recovers, but over a period of time. The transection, for many years, was an impossible condition to treat. Once the cord had been cut, there really wasn't much that anybody could do except provide palliative care. And for young men confined to wheelchairs who couldn't really use their arms or legs, it was a heartbreaking situation. Anyway, medical research and innovative thinkers have done some wonderful things. And we're now at the point where those injuries can be fixed using stem cell therapy. And the way that that procedure is carried out is the two ends of the spinal cord that have been separated. They are brought back together, they're reapproximated, and a tissue flap of stem cells is laid over the two areas. And then an external brace is applied, and the patient is kept as motionless as possible for a period of time. And what happens is that the stem cells stimulate the growth of nerve cells from one end of the cord to the other, so that there is a regeneration of the cord and a reconfiguration of the cord. Now, it would be great if these young men had their function returned to, the level that it was before. That's not the case, but they do, however, get back to at least 50, if not 60% of their pre-injury function. So, I would say that with regards to the spine and with regards to spinal injuries, the advances and the progress that has been made over the last 10 years has been significant, and this is a very encouraging factor for me, and it should be for the population. Thank you.